Hey everyone, today I'm talking about something you need to know, the HMPV virus. Human Metapneumovirus, or HMPV, is a respiratory virus that can cause symptoms similar to the flu or the common cold. So what exactly are we dealing with here? HMPV primarily affects children, the elderly, and those with weakened immune systems. The symptoms include cough, fever, nasal congestion, and shortness of breath. In severe cases, it can lead to bronchiolitis or pneumonia. So, how is HMPV spread? Just like many other respiratory viruses, HMPV spreads through respiratory droplets when an infected person coughs or sneezes. It can also spread by touching surfaces contaminated with the virus and then touching your face. Now let's talk about treatment. Unfortunately, there's no specific antiviral treatment for HMPV, but don't panic. Most people recover with supportive care. This means staying hydrated, getting plenty of rest, and using over-the-counter medications to alleviate symptoms. In severe cases, hospitalization might be necessary for oxygen therapy or more intensive care. Prevention is key. Good hygiene practices can help protect you and others. Wash your hands frequently, avoid close contact with sick individuals, and disinfect commonly touched surfaces. Also, consider wearing a mask if you're in a crowded place, especially during the cold and flu season. That's it for today. Remember, always consult a healthcare professional if you or someone you know is showing severe symptoms. Stay healthy, stay informed, and I'll see you in the next video.